disorders can probably go away with counseling on their own. With that, and with the aid of some type of like psychotic medication, but not necessarily necessary. Where with psychotic disorders, some form of schizophrenia, other psychotic disorders, you might want to stay on it in order to maintain stability. Because these are very unstable.
Are things like psychotic disorders or schizophrenia, is that something that like an event will trigger it and it stays with them, or is it something that they're born with, stuff like that?
Usually, like, you find that there's hereditary lines, and it's usually triggered at a certain age. Like, schizophrenia starts around like 18 years old, yeah, like right when they're hitting that age of experiencing the world, and that's kind of the problem, because you're thinking that they're just like trying to, you know, delve into what else is out there in the world, and what's actually happening is that, you know, there's a lot going on in their system.
So you can't really diagnose it earlier, right? He usually
There's studies that say that, you know, that you can anticipate that there is some sort of psychotic disorder, but I would never. I mean, it's not something that you would say like, oh, this kid right here is definitely, you know, schizophrenic when he gets older.
Typically, they look very normal before they're 18.
Yeah, very, very normal. It's really scary. Really, really scary. And then, and psychotic disorders is usually when you go to like an inpatient ward at a psychiatric hospital. Those are the patients there. And obviously the ones that are like bipolar and like manic and can't handle themselves, there's possibilities that they're in the psychiatric ward, but the majority of them are the psychotic disorders. People who have depression don't usually end up in the psychiatric hospital, other than like for like a week to get stable and then go back to their homes. But the long-term stays are usually the ones that have like major psychotic disorders. But there are also a lot of them that are living really well on their own, and they live in like group homes with like a counselor that goes in and checks on them every day, doing really well on medication. I mean, it's all over the place. And because they're medicated and they're well regulated, they're independent, most of the time, you know, like they have to have somebody watching over them, but they have their own apartments and they do really well. But there's some that can't get regulated.
So just one thing that I think is important to know about schizophrenia is it's not the movie Schizophrenia. Like, it's not multiple personalities. So everything schizophrenia is multiple personalities.
Right.
Which is very, very different. Most people who are schizophrenics are like so involved with internal stimulus inside their brains that they don't really communicate with anybody because they're so involved with what's going on inside here. Like, very rarely do you see the type of things that you see on TV. It happens, but
it's really, really rare.
It's really rare. Like, most of the people you see are so involved in their own head, they say confusing things that don't make any sense, disorganized thought, or like cyclic.
You can see, like, sometimes you go into like, I've had clients come to me and be like, I'm not going to see you because I'm not like that guy. I saw a bunch of guys in the waiting room, like they were waiting for like a medicine, educational group, and like a lot of them come in for it. So like they'll wait in the morning, and they're usually during the day because they don't work or anything like that. So like all sitting around and like they're talking to themselves, and, like, or pacing, and you're like, oh, I'm not like that. I'm not going to go see anybody. It's a very, very low functioning. It's not a high functioning person that can, like, you know, have, you know, a husband and children and go to work and go to college. There's some that can do it, but it's unlikely. So you're unlikely going to see somebody that has a psychotic disorder because they've probably been taken care of. Unfortunately, I mean, a lot more overseas than here, but you do see that these individuals are kind of kept under wraps. And like sometimes, like I've heard people say, like, they don't even exist. Like, I only have 2 children. They don't talk about that third child that has, you know, a severe mental health disorder. So they kind of like keep them, like, you know, in the home, and they have somebody come take care of them. If you've seen it happen, less likely here, but when they're here, the parents don't even mention it. And when you hear about it, you're like, wait, you have another child? I didn't even know about it. It's pretty sad. Because there's a lot out there for them to experience, and the parents just say, like, khalas, they're done with them. Something you can experience, and I've experienced when I went to, like, and I'm sure Naveen might have more, because I know you have a bunch of younger girls, like, that are still in, like, college and high school in your meetings, right? What do you guys? Groups, sorry, in your groups. I tell you that when I went and spoke to the high school girls at Ghazali, and I spoke to Iftah al-Aloom, and I went and I used to, when I was working full time, I was doing a lot of trainings, and I go and speak to them. A lot of them like come and like whisper in my ear and be like, you have to talk to this girl because she's throwing up all the time, and this one's binge eating, and this one's, you know, starving herself. A lot of them I say
Cutting themselves in our school.
cutting themselves. That's,
Like
I mean, that's
Islamic school.
yeah, that's not,
Cutting
that's
is very common.
very common, and it doesn't necessarily fall under mental issues. Definitely we'll bring that up at the end because I want to just cover that.
Borderline.
Yeah, it's a little bit differently. But eating disorders are common. It has to do with their relationship with food, and a lot of times just a distorted relationship with food in the sense of you know, getting constant criticism when they were younger and not being able to like balance their feelings of their, you know, self-confidence and self-esteem and be able to like feel good about themselves and eat normally. It's extreme emotions and attitudes involved in food. Like I said, most of you heard of bulimia and anorexia, and I think that, like I said, it's primarily female, and it's more towards like, I mean, it's all over adults as well, but mostly in younger girls you see it. And then there's impulse and addiction disorders. And impulse and addiction disorders are you're unable to resist the urges and impulses to perform acts that are harmful to yourself or others. These are things that like you kind of hear about in movies. You're kind of it's interesting. It's a little bit weird. Pyromania, which is, you know, someone that's like starting fires. Kleptomania, compulsive gambling. And then drinking and alcoholism fall into this, not drinking, just alcoholism and like substance abuse falls into these categories. It's fun. Go ahead.
Sorry to cut you off, but can I go back to the eating disorder?
Yeah, go ahead.
So, like you said, like a lot of, in our community, like it's all like hush hush, you know, not my daughter, how can this ever happen, you know. But like what if you do know of a case, you know, and several times you tried to like, you know, help them, stop them, whatever it is, and you don't know if it's still going on, like they'll tell you, you know, that's it, I don't like.
Okay, so.
And you're afraid to go to the parents because then the parent would be like, "Oh, not my daughter," you know.
It's
then, like,
really obvious. Like I've seen people like die from it. Like it's. I mean, if someone's really anorexic,
yeah.
I mean, it's skin and bones. Like
Not, and
someone
I think it's bulimia when you throw up.
Bulimia is when you force yourself to throw up.
Yeah.
It's just somebody that comes up like they have like a lot of really severe conditions.
Yeah.
Like somebody. I'm not saying that it's very very common for high school girls.
Yeah.
So it's not that they're not throwing up or whatever, but you will see a significant effect in the way that their appearance, their eyes start to get all like, you know,
Lose the fat pads.
yeah, everything. They're just, it's literally skin and bones. Like it starts getting really scary. And you see like, you know, celebrities that they talk about, like, oh, you know, eating disorders within celebrities. Like you see how they look like this is in a completely not the norm.
So what measure would you take? Like,
honestly, I don't work with eating disorders because it's very, very, very hard. It's very hard to work with an eating disorder. Where I think what works best for them is when they're sent to a home for eating disorders, and they kind of sit amongst girls that are going through the same issues, and it helps them like almost more than anything else, I think, in the sense of the support, hearing other girls going through the same things, even more than other things. Other like disorders, I feel like within the eating disorders. So it's really important to speak to parents. It's not something that you can just be like,
gonna say, like,
you know, it's not a big deal and it'll go away on its own. Go ahead.
Like I think that there's a big difference in bulimia and anorexia. Anorexia, they don't have a proper body image, like, so they have a distortion of their body image. So they think they're fat even though they're extremely thin.
Yeah.
Bulimia, not necessarily. Bulimia, you can have a normal body image. You just binge eat and you vomit whenever you can, kind of thing. So anorexia, the symptoms that you'll see are people who have like super cachexia, it's called, like when they literally lose like the fat on the temporal area, that means that you're starving. Like it's beyond a certain point. You know, women won't get their cycle for 6 months, right? That's the official diagnosis, right? It's a whole bunch, and they can die because of a whole bunch of electrolyte things. Like the only way is counseling. Like talking to them won't help because anorexia, they have they have walls up.
That's it. That's what I'm saying. Like that's why I don't even do it because it's you can't.
But the first thing would definitely go to the parent, like no matter what.
You have to.
You have to, right?
It's so because it's so serious.
Okay.
I mean, I would go to the parent. I would go to the guidance counselor in their school because then the guidance counselor can actually take like legal, make sure that the person gets help and things like that. You have to.
Also, when he was discussing like anorexia being like a body image, there's also body dysmorphic disorder, where it's kind of like a little bit taboo in our community. Our community meaning like as a professional, like a lot of people actually don't believe that it exists, where it's someone not necessarily with an eating disorder. They don't fall under eating disorders, but someone who has a distorted image of something in their face, their body, I had someone come in to see me for months, and a good-looking kid, and I swear to God, he thought he was never gonna get married. He was scheduled for plastic surgery. I had to talk about plastic surgery several times because he felt like one side of his face was not as symmetrical as the rest of his face. And what happens is that they usually get the plastic surgery and it's never enough. So they keep getting plastic surgeries. You kind of think like Michael Jackson somewhere back here, like we're like in an extreme case, but it really is. It's kind of, I don't really know how people say it doesn't exist because I've seen it so many times that it's beyond like low self-esteem. It's someone that cannot view themselves. They look in the mirror and they cannot view themselves and they're completely, utterly obsessed with image. That they'll walk past the mirror, they're looking at themselves, how is it today? Like, how do my eyebrows look? Are they symmetrical? They're not symmetrical. It has a lot to do with symmetry. And sometimes it's something in their body. Their arms are too fat, so they won't leave their home because their arms are too fat. They spend a lot of time just obsessing. It's obsessing. I think it falls under.
We fall under both of them, I think, like OCD.
Yeah, it falls under OCD, I think.
Like I've had 2 patients. The 2 patients we've had is the nose. Like the nose is never fine, so they've had 6 rhinoplasties, and they'll keep getting. Their nose isn't right no matter what they do. And then there's the woman who thinks that her arms are too big, and she's lost so much weight, and her arms are really normal. If you look. We've even tried to measure it and show her, look, your arms are perfectly fine.
It doesn't really matter.
It doesn't help.
And then there's earlobes. It could be anything. It could be their hair is thinning, and it's fascinating. But it's very because when you speak to somebody, you're like, you have no idea that how normal you look, and subhanAllah, that's kind of what happens with a lot of these things. That you look at them, you're like, or you'll say you don't know how good you have it, or things like that, and you have to make sure you don't minimize it, make them feel like, oh, they don't understand, they think I'm normal, and this is ridiculous, so they just stop seeing counselors. And I've had that happen to me too, especially with this specific disorder, because they feel like
they didn't understand.
They don't understand, and and a lot of the times they don't even realize what they're doing. So I'll be like, oh, you find that you spend a lot of time in front of the mirror, and they're like, how'd you know that? Or you leave your house, and you're like, well, no, I can't leave my house unless it's in the evening because I don't want people to see that when I leave the house, my hairline shows a little bit more during the day, but in the evening I'll try to leave my house more and do my shopping at night. Sometimes I won't even go out at all. It's fascinating to somebody who's watching and analyzing, but at the same time it's really debilitating. So that's when you were talking about anxiety, this made me not anxiety, anorexia it triggered that, but that has nothing to do with eating disorders. It's different. Anxiety is a form of that body image in the person's head. That's why I feel like it's much better to just refer out. And I'm going to have Negwa talk a little bit about referring and the school system. But let me just I'm almost done with giving you guys that background. So. I was talking about addiction disorders. It's basically people getting so involved with their addiction that they ignore their responsibilities and their relationships. So a lot of times somebody might be have substance